Patient education is critical. Dental work is a journey that we travel together. Whether we're doing a single tooth or whether we're doing a full mouth, it's really important to have a patient who really understands that what we're doing is important to us as much as it is to them. When a patient feels heard, when they really understand what the process is and what the end goal is, the patient knows what's going to happen. They are prepared for the easy parts and the tough parts, and when we get to the outcome, they're just that much more appreciative. Traditional dentures, you can't chew the same way you could. You may gain 30% of your chewing back. A lot of times they'll dislodge when you're talking, when you're chewing, social situations, they can pop out. The gum and the bone start to recede and go away to the point where you may not even be a candidate for implants at some point. The way that an all-on-4 fixates the teeth into the mouth with no mobility, no movement, really allows you to bite into apples, corn on the cob, chew nuts, just really function the way you could before you started having tooth problems. And we really can't reproduce it to that level with any of the other options. So there are different kinds of materials that the all-on-4 teeth can be made out of. There's everything from the traditional acrylic all the way to zirconia, which is really the strongest and toughest material that we use in dentistry today. We do an additional step called a print try-in, where we fabricate a provisional. That way they have an opportunity to view the teeth in their mouth, look in a mirror, say, you know what, I'd like them a little longer, or I'd like them a little shifted this way. Any of those things can be modified based on patient preference, and that's why we try in those teeth first. So maintenance for the all-on-4 procedure, you still want to brush the prosthesis to make sure that any staining is removed. You'll use a water pick underneath to help make sure that there's no debris building up between the teeth and the gums. And then as far as the in-office maintenance, we'll typically see the patient every 6 months. After about 3 years, we typically would recommend at least once a year, but twice a year is really the ideal maintenance schedule. You buy a new car, it doesn't mean that new car is going to run just forever without any maintenance. You need to be doing your part at home, but also they need to make sure they're seeing us twice a year so that we can make sure that the gum area beneath the all-on-4 teeth or the implants underneath the bone, we need to evaluate that and make sure that's doing well. A lot of times people are embarrassed to show us their teeth, and really they don't need to be. They really need to be proud that they took the time to make the step to improve that. And just by coming in the office, that's a huge step. Patients who are fearful really benefit from the use of sedation. We can really create an experience tailored to the patient that's much more relaxing for them. We can do as much dentistry or as little dentistry as they want, but in a very comfortable environment. What I say to somebody who's on the fence is, if you want to improve your smile, your confidence, then it's time to step into the office and at least have the conversation. It doesn't commit you to doing anything, but I will tell you this, I've done thousands of cases and I've never had a patient at the end say, gosh, doc, I wish I didn't do that. They always say, gosh, I wish I would have done that 10 years ago.